Hi, Paul Griffin here, MARTA's Director of Infectious Diseases, with another update on COVID-19. And the situation continues to improve. We continue to have very low case numbers, which is obviously fantastic. And as a result, we're seeing further relaxation of the restrictions coming up. It's still really important, however, to maintain all the fundamental principles that have got us to this strong position. Social distancing, hand hygiene, and particularly if you're unwell at all, you should get tested and stay home to prevent passing anything on to anybody else. And we see the restrictions relaxed this weekend, particularly for Mother's Day. It's still going to be important to maintain all of those things, including the social distancing. So you might have to avoid those hugs this weekend, but it'll be great to get out and enjoy a little bit more freedom. But we need to make sure everyone continues the behaviours that have got us to this great position. As we continue to focus on our preparedness for COVID-19, it remains important to look after your medical problems and your general health. This includes things like the flu vaccine, and now is a really good time to get that if you haven't already, as well as seeing your GP or specialist for any medical problems that you might have to make sure they're looked after as well as possible. I've had a lot of questions this week about the possibility of multiple strains of coronavirus. And in short, it's too early to know if that's indeed the case. And even if it is, what the implications of that will be. There's a lot of concern that it might undermine the development of vaccines for coronavirus, but I don't think that's going to be the case. And at worst, it might slightly delay the progress of vaccine development as we may need to incorporate multiple strains, but I certainly don't think it's going to be a big impediment to us getting a vaccine for coronavirus. As we approach the colder months, there's a lot of questions around whether coronavirus will be worse in winter. And really it's too early to say. We don't really think temperature or humidity or other environmental conditions have a big impact, but obviously if we keep doing all the right things in terms of social distancing and hand hygiene, irrespective of the external environment, the weather, we're not going to see a big spike in cases. So basically, keep up the good work. I've had a few questions recently about whether there's any negative impact of all the hand hygiene that we're doing. And in short, it's definitely no. While there's some concern about the microbiome or the hygiene hypothesis being affected by all this hand hygiene, it's in fact not the case. And really, hand hygiene is still the single best way of protecting ourselves from coronavirus and all infections. So keep it up. I've been asked whether social distancing and hand hygiene will continue into the future, and I really think it will be the case. What we really need to be able to lift the restrictions that we're starting to see lifted now is that all the things we've been doing become a sustained change in behaviour. So irrespective of what we're forced to do, people will continue to stay away from others, keep that social distancing and keep up their hand hygiene so that we continue to see coronavirus be so well controlled, which is the case currently in Australia. It's really great to see the restrictions being lifted, and that really relies on all of us doing the right things, the hand hygiene, the social distancing, but also I'd really encourage people to get the app, COVID Safe, so that if we do see any further cases, we can make sure we contain them really readily so that we don't see big outbreaks again and we keep having this great level of control that we're seeing at the moment.